A historic $50 billion lifeline for rural healthcare is now open for applications, but states have just weeks to act before the window slams shut. This bold initiative, born from the GOP's tax and spending overhaul, aims to stabilize rural health systems reeling from Medicaid cuts. Yet the devil is in the details. But here's where it gets controversial. Half the funds are distributed equally to every state, while the other half are handed out at the sole discretion of CMS Administrator Mehmet Oz, sparking debates about fairness and accountability. Let's unpack how this plays out. The Trump administration has officially opened the door for states to submit applications for the first chunk of this 5-year fund. Deadlines are tight. Applications must be in by November 5th, with decisions finalized by December 31st. Oz, flanked by reporters, framed the program as a chance to catalyze innovation and shift rural healthcare from a survival mode to a thriving future. If we invest wisely, he said, we'll transform systems that are barely hanging on into engines of progress. Here's the catch. $25 billion will be split evenly among all states, regardless of rural population size. The remaining $25 billion, however, is a wild card. Oz has sweeping authority to approve projects based on metrics and potential impact. Though the law offers no strict rules about directing funds to rural hospitals or CMS approval for rural-focused spending. And this is the part most people miss. Rejected applications can't be appealed, and funds can be yanked back mid-program if states fail to meet performance goals. This isn't punitive, Oz insists. It's a clever incentive to keep governors on track. So what can states do with the money? Prevention programs, chronic disease management, provider payments, and hiring new staff with 5-year rural service commitments are all on the table. But Oz is clear. This isn't a slush fund for old bills or routine costs. It's about reinvention. The program's 5-year timeline is intentionally brief, designed to jumpstart change before fading out. We don't want to prop up failing systems indefinitely, Oz explained. The stakes are high. The tax law slashes $1 trillion from Medicaid, hitting rural hospitals particularly hard. 7% of total Medicaid spending flows through them. Yet, they serve a disproportionate share of low-income patients. A KFF analysis predicts rural Medicaid funding could drop $155 billion over a decade. Critics argue this fund is a temporary bandage, while supporters see it as a catalyst for long-term solutions. What's your take? Is this enough to fix rural healthcare's broken model, or just a political maneuver to distract from deeper cuts? Share your thoughts below. Let's debate.